Let's speak to the president of the Arizona Medical Association, Ross Goldberg. Mr. Goldberg, great to have you on the programme. Notoriety then for all the wrong reasons. What do you think went wrong?
Yeah, first of all, thank you for having me. And yeah, this is the time you don't want to be number one at something. I think it's a multitude of things. You can't ever say you point to one individual thing, but you heard during the piece, one problem is a lot of people didn't believe that we had a problem here. It really does take the entire community to work together to stop the spread of this. From the leadership down, we all need to kind of play our part. As you saw, as soon as the stay-at-home got released or at least relaxed, a lot of people went out like business as usual, which is not the case. And we're running into a lot of people that still don't believe that we have a problem.
I keep watching the president tell us that there's too much testing. 8 days to get a result? How many people can you infect in 8 days?
It's an exponential spread. I would respectfully disagree with the president that we aren't doing enough testing. The whole argument that doing more testing means some more positive cases isn't fully accurate. Yes, you may find more positives. The more striking feature is the number of hospitalizations, which I can tell you in Arizona has gone up exponentially the last few weeks, really pushing our resources.
When you go into the hospitals, what are you seeing right now?
So I actually work at one of the hospitals in Phoenix. I'm a general surgeon at Valleywise Health, our public hospital. We're pushing our capacity. We're not there yet, but we're getting close. A large percentage of the patients are COVID now, or they're becoming COVID patients, or that number is taking over, you should say. But we still have other people we're taking care of as well. We're all wearing our PPEs, the masks, the face shields, the gowns, the gloves. Everyone's doing their part and working really hard. But for as many as we discharge, many more come in. So it's a stream of patients that we can't stop right now.
One of your physicians in Sophie's report said that he dreads the moment when doctors might have to make decisions about who they treat.
Yeah, we're not there yet. I think, we are in crisis standards of care. We have that ability, which is allocating resources. I would remind everyone, like every day, even pre-pandemic, the concept of triage does exist. In the emergency rooms, when 3 people walk in, the sickest one will be addressed first, but all 3 will be taken care of. We are still taking care of everyone. We have postponed our non-essential elective surgeries, meaning those that can wait, we are trying to delay like we did back in March. But everyone is still getting access to care. I pray we don't get to that point where we have to start deciding that, but we aren't there yet, fortunately.
The White House has been surging resources into Texas. How much communication, how much contact do you have with the federal coronavirus task force?
Well, personally, I don't, but I have the opportunity to speak with our state leadership, and I know they have been in contact with them. Dr. Birx was here in Arizona, I think last week, if I remember correctly, and I do know there is some communication going on where we're getting resources as well. The governor recently announced that. I think we have testing coming in, as well as staff that we need, because that's the biggest resource I worry about, is running through our staff. So there is staff coming. I think of the number of 500 people they've talked about so far. Hopefully we won't need all of them, but we'll likely need more if this keeps on surging.
It's becoming so political, like everything else in the United States at the moment. The president refuses to wear a mask. He wants schools to go back in August. It seems a bit odd, the sort of message that the White House is sowing when we look at the picture there in Arizona.
Yeah, politicalization of this has been very upsetting. The message I try to ask everyone is that when they get sick, who do they go see? They don't go see their politicians, they go see their physicians. So I'm asking them now to believe their physicians and to do what we ask. The physical distancing, wearing a mask. As a surgeon, I'm used to wearing a mask for long periods of time. I understand the use and the safety of wearing a mask, and I'm asking all of my patients and everyone to please do the same.
And the morale of your staff? I mean, when you're doing this day in, day out, week in, week out, how does the morale hold up?
Well, obviously, overall, it kind of wears you down. I will say I'm very fortunate at my institution. Our leadership has been very proactive and also very transparent with everything going on within the system. So our morale is pretty good because we know we have support from up top, which makes a big difference. So having that connection with our leadership has been huge for us because we're all in this together. So we're actually doing okay, all things considered.
And just from a medical perspective, I listened to Anthony Fauci, who is the most respected epidemiologist in the country. He says that the United States is still knee-deep in wave 1 of the pandemic. Is the battle lost? I mean, given the spread across the Sun Belt, is there anything that testing, track and trace can do now? Or is it just hang on and hope for herd immunity?
Well, yeah, we are knee deep, but no, I always believe there's a chance and a way to get ahead of this thing. I think we're putting more resources in testing. That's important. I think also it's getting everyone to buy in that we're all in this together. We also have to remember there's a time delay. So if we do everything today, say everyone does the physical distancing, the mask wearing, we won't see anything for a couple of weeks. We have to remember that it will take time to see results. But we definitely can do something about this if we all kind of have each other's backs on this.
Russ Goldberg, it's good of you to come on the programme. We wish you all the best.